Real Arkansas patient stories, real impact, and the moments that show why medical marijuana matters. This is Arkansas Patient Stories with King Honey, presented by Roots Reefer. How you doing?
I'm great.
All right. Well, thank you for sharing a bit of your story today, and we'll just jump right in if that's okay.
My pleasure. Glad to be here.
Tell us about your years in the service and how life changed after coming home.
Wow. Okay. So I spent 13 years active duty. During those 13 years, I had two major deployments. First one was 10 months in Bosnia, which at the time seemed really drastic, but it wasn't so bad compared to the last one. The last deployment I had was 13 months in Baghdad, which was my last official duty station before getting out of the Army. So 13 years active duty, two major deployments. Just as a side note, I was in Fort Drum, New York when the Twin Towers were bombed, so we were close to that situation as well. So
a lot of big happenings, experiences, and just some traumatic times, quite frankly.
Yes, absolutely.
So at a bit of your toughest point, I want to ask, what did your medical routine look like, from prescriptions or doctor visits, things like that?
Of course, as a soldier, you get the opportunity to be checked up twice a year. So I was on approximately 7 medications, and what threw everything into a disarray was one of my medications, my blood pressure medication, threw me from anxiety into a series of panic attacks, which ultimately ended up with me serving, spending overnight in the hospital for what they assumed was a heart attack, which turned out to be panic attacks, which I had never experienced. So after that experience, I made sort of a drastic decision. It seemed drastic at the time. I stopped taking all of my prescription medication because I had told my healthcare provider that that particular medication was not feeling well, but she insisted that I continue to take it. Fortunately for me, I met a young lady at the apothecary, and she introduced me to hemp, the full spectrum CBD and CBG. Since that time, I moved back home, as you well know, in 2023, and you introduced me to the chronic pain community as you were sitting on some medical marijuana panels. We actually had an opportunity to experiment and to test and grade and rate all of the cannabis, not just the flowers, but the tinctures, the dabs, the topicals, the whole line. And so I was fortunate enough to be introduced to what was actually going to change my life for the better, and it has.
Wow. So once you transitioned from 7+ prescriptions to medical marijuana, what is one of the first things that you noticed that changed?
Quality of life overall changed drastically. When I stopped taking my anti-inflammation and anti-spasm medications, my inflammation subsided. The spasm subsided. I didn't know it at the time, but the hemp extracts, the CBD and CBG that I was taking was working perfectly as it should work in conjunction with my natural body. I didn't know that at the time, but that was a blessing in disguise.
If you had to name your go-to veteran strain, what would you call it?
Popsicle.
I like
or maybe what was it? Combat Cook.
Another brilliant one. Tell me a little bit about what we're looking at here. Give us more insight just on your duties, the weight that you carried during your career.
Okay, absolutely. Okay, so this was actually, I mentioned the two deployments that I had, the one in Bosnia, 10 months. This is actually the last deployment in Baghdad, which I served 15 months. So this is the duty descriptions and my actual duties while I was there. So I'll just read a brief description of the first achievement, okay, which will encompass what I did overall. As the first regimental non-commissioned officer arrived at Camp Wolf, Kuwait, Staff Sergeant Murray was in charge of the movement and control of over 4,100 2nd ACR inbound troops. He ensured they were all briefed, administratively in process into theater, and receiving all entitlements in a timely manner. Staff Sergeant Murray's vast knowledge and versatility allowed him to also function as S4 movement control representative, coordinating and moving all supplies, equipment, and containers from Camp Wolf Airfield to Camp Victory with 100% accountability. Okay, so my responsibility, even though at the time it didn't seem as daunting, it was a huge task, but that's what we trained for. So I was very proud to be able to lead my group into Kuwait, and more importantly, lead them into the theater of operation, Baghdad, over into Iraq, without any incidents or accidents.
So it wasn't even just you keeping yourself safe and alive, but you were responsible for over 4,100 soldiers.
Absolutely, and that's a burden that you don't think about, because we were all trained to do our jobs as well. And so, but coming back home, those burdens weigh heavily, and some of the dreams that loop in doesn't go away, and you can't change the channel. Part of the PTSD drama was the depression and the anxiety and the dreams, you know, the nightmares. So once I stopped taking prescription medication and started relying on cannabis, the dreams subsided. Of course, they don't go away. Chronic pain can't be healed, but we learn to manage it. So I did realize that I made two big decisions. One was to stop taking prescription medication, and the other was to effectively start managing my chronic ailment exclusively with cannabis. And I can tell you right now today, that was a life-changing, a life-enhancing opportunity for me. And my mission moving forward is to get as many service members that I know are feeling the same that I felt, getting them introduced to medical marijuana, and to know that the benefits of the cannabis plant far outweigh those side effects that we are being affected with from prescription medication.
Here in Arkansas, when cannabis became legal for patients like Dedrick, it gave thousands of veterans another option, and for some, another chance. You can hear more Arkansas cannabis stories on the Roots Reefer documentary on YouTube.